Hello, everybody. This is Dr. Basu-Ray.
Mahesh Joshi DD or Mahesh Joshi.
Maheshji, I'm going to go live in 2 seconds. हाँ, बात करेंगे. This is Dr. Basu-Ray. We should be going live in a minute. I should talk about COVID and heart diseases and role of yoga in prevention of a lot of problems that we see during lockdown and even in patients who might have symptomatic but not severe COVID. So tune in the next 1 minute. We shall start exactly at 8:30 a.m. Indian time and 10 p.m. Central Standard Time. Yeah, starting Sheetal. Good morning, everybody. In India, and good evening, everybody here in the Western Hemisphere, in the US. I'm Dr. IndranilBasu-Ray. I'm a cardiologist and a cardiac electrophysiologist, and also we've been doing research on yoga for some time now. So today I'm going to talk on something that is totally new, based on over 100,000 patients with COVID in the United States of America. We now know that almost all severe cases, moderate to severe cases of COVID, has cardiac involvement. They have severe the heart size enlarges severely. They have heart failure. They also have something called myocarditis, that is inflammation of the heart. Now, the funny thing is that based on research, we now know that this is not a minority. In fact, majority of the people who have died out of COVID and majority who have even recovered from COVID, but who have been hospitalized and had to go through moderate COVID, even they have, a majority of them have cardiac involvement. Now, the question is how we can prevent this, because now the question that may be asked is, do people who are not hospitalized, who are sitting at home, who are in lockdown, and who might be having mild to moderate COVID, are they involved also? Honestly, we don't know. As you know, there are thousands of people filling up hospitals, so there is hardly any time to do research on common populace sitting at home. But what we do know that during this period of lockdown, three important things can happen that can also affect the heart. One is people get anxious, so there is anxiety. Number two, people develop depression because of human being is a social animal. So you'd like to walk around, talk to people, sit down with your family or your friends and spend a nice evening. But you cannot do that in these days of COVID because everybody that you talk to or might have COVID unknown to him and to you. And now there is some research in the last 2 days that says even if you breathe, like suppose there's a closed room and you are breathing inside that room and you are COVID positive, but you had no symptoms. So you don't know that you are COVID positive. You might have gone out yesterday evening to the bazaar and picked up some vegetables. During that period, you might have come across a COVID patient. So you are COVID positive now. There's COVID virus within you, and you may be shedding that virus, and neither you know nor that person know. So just breathing inside a closed room, you can shed virus. So another person who comes into that room can get that virus and get infected. So the other, what we initially thought, COVID infection comes only from coughing, sneezing. That's not true. It can also come in a closed space. When you're breathing, the virus should be shed out, and that shedding can cause you to have COVID. So now the question is, when you're in, that's why it's important to stay in complete lockdown. You should not go out, try to avoid meeting anybody, and in case you do end up meeting somebody, make sure that you're at least 6 feet from that person to save yourself from COVID. And as you know, till now we don't have any medicines, any vaccine. The one and the only way to save yourself is completely locking yourself down. Now, locking yourself down is easy to say but very difficult to do. Why? Because this long periods of 14 days, 21 days that you need to stay in lockdown can have detrimental effect on the human body as well as human mind. So the detrimental effect on the mind is because you can have depression, you can have anxiety. Some people even have panic attacks on the thought of getting COVID. And what is worse is all these three, that is anxiety, panic attack, as well as depression, can actually open the gate for you being more likely to be infected with COVID. And why? The reason is very simple. The reason is because your immunity comes down. 20 years back, medicine did not believe that if you are depressed, that decreases your immunity. If you're anxious, that depresses your immunity. Now we know, after over 20, over 2 decades of research, we even understand the molecular mechanism, the changes in the brain, the changes in the neurotransmitters in the brain, the changes in the immunological soldiers in your body, like the WBC, monocytes, macrophages, that happens with the fact that when you're depressed or when you're anxious, your body gets there's decrease in immunity and you wide open the gates for having infections. Now, it's important to understand COVID a little bit more to understand how you can prevent yourself, you can save yourself by not only preventing depression, not only preventing anxiety, by certainly preventing any panic attacks, but also boosting your immunity using yoga and meditation. But before that, let's talk a little bit about the immunity and how it happens, how it works. So body has two type of immunity. One is known as innate immunity, and one is known as adaptive immunity. So innate immunity is the immunity that you have when you're handling an unknown enemy. So COVID is an unknown enemy. Body has never seen COVID before. So bodies fight for COVID. Suppose COVID enters you today. What body will do is it will have a fixed protocol to fight with COVID, which causes release of certain things called interleukins and interferons in your body. There are different cells in the blood called the MHC complex. They can actually help eating up viruses and bacteria like this, which are not known to the body. So anybody like you, me, or millions of people who are not yet infected today can still fight COVID by this sort of immunity, and this is called innate immunity. And all the cell surfaces, like for example, the cell surface of your lung through which COVID attacks, produces a bunch of chemical that helps in binding and killing these viruses so that it cannot enter the body, like immunoglobulin A. So this is a very complex but very effective system to thwart away unknown enemies like the COVID virus, which body has not seen before. But the situation changes completely when you already have COVID and you have recovered from it. So when you have COVID and you recovered from it, which happens only in mild cases, what happens is body produces immunity or antibody against that COVID, so that and that kills the COVID. So now moving over to yoga, what does yoga do? There is bunch of studies actually which shows and which are meta-analysis that actually shows that yoga and meditation both can treat depression. In fact, there's a study of over there's a randomized clinical trial of over 60 minutes of yoga per week for just 6 weeks has shown that depression can significantly be improved with yoga. Multiple RCTs trials have also shown that anxiety can be improved with yoga. In fact, there's one trial which shows that drugs using medicine for depression and using medicine and rather than using yoga, the effect of medicine and yoga is same. Similarly, for panic attacks, there has been multiple studies that shows no difference between whether you use a medicine, whether you use a drug, or whether you use yoga to treat them. So multiple meta-analysis, not one. This is just a talk. I cannot provide you actual references, but I'll be more than happy to do. If you email me, actual references that shows yoga has a very powerful effect on mild to moderate depression, anxiety, and can actually prevent panic attacks in patients who practice regularly. And the funny part is, most of these studies, some of the studies have done yoga for 20 to 40 minutes all days a week. But in some patients, they did yoga only once a week or only twice a week. And despite doing it once and twice a week, they had similar effects. And that shows how pure, powerful yoga can be in your life during this period that you are practicing this lockdown when you have nothing to do, you're just sitting at home. So just 40 minutes practice of yoga, which I advise, is some plain simple exercise, and I'll come to that in a second, some breathing techniques. But before that, let me talk about immunity. There has also been a large number of studies by scientists all over the world on the role of yoga in improving immunity. So one of the things that happens in COVID is you don't die because of COVID. COVID doesn't kill you. COVID has not killed a single human being. People who have died out of COVID is because the body reacts to COVID. So what does the COVID do? COVID completely suppresses your immunity. That's why it takes so long to get symptoms. You get symptoms from influenza in 2 days, but from COVID, it might take 5 to 14 days to get symptoms. Why? Because your immunity is completely suppressed by COVID. But when the body reacts back, the body realizes after 10 days or 14 days that it has been made a slave. All that it's doing is it is producing hundreds and thousands of viruses. The virus, the enemy, the evil enemy has completely taken control of your body, and your lung cells are only producing COVID. That time the body hits back. And the tragedy is, in moderate to severe cases, it hits back so badly, we have something called cytokine storm. So there are hundreds and millions of chemicals released all over the body, dangerous chemicals like interleukin 6, interleukin 12. Hundreds and thousands of soldiers are released. These are the macrophages. These are the white blood cells inside your body. Dangerous cells to eat up the viruses called the natural killer cells are released inside the body. What do these do? These just don't eat up the virus. That kills the body, that kills your lung, that kills your heart. And in fact, it has been seen that possibly, though we don't know for certainty, all these people with severe cardiac disease in the terminal stage of COVID, hardly a single COVID virus is found in the heart. So all the heart failure, the heart damage, the myocarditis is actually produced by chemicals produced by you, the human body who got infected by COVID. Now this uncontrolled reaction of immunity against the COVID actually kills the person. So that's very important to understand. Ultimately, people with moderate to severe COVID, when they succumb and when they die not because of COVID directly, but indirectly because of COVID, as the body mounts a massive reaction, produces cytokine storm. Now, yoga is actually known to increase some of this innate immunity that will help you prevent getting COVID. For example, your IgA is increased, and IgA prevents entry of viruses, bacteria through your lungs, through the outer lining of your lungs. Interleukin 6, in a study in 2014, it was clearly shown that the interleukin 6 is reduced, and interleukin 6 is one of the things that ravages the body and can actually be killing people in severe COVID. So we are now actually trying to do research in America on a drug that is a selective interleukin 6 inhibitor. So what you can, and the drug is still in trial. It might take a couple of months, not 1 month, maybe a couple of months for us to know if it is actually working and if it can be actually used in human beings. But remember, doing yoga gets you much more powerful without having any medicine, without buying any pharmaceuticals, but you can stay safe at home. And most of the trials with yoga is within a few weeks. So this 3 to 4 weeks that you are going to do yoga is enough to get your immunity up. So you got to start from today. And what I advise is very simple. Do simple postures, 2 or 3 physical postures, not more. You don't need to do a ton of postures. Just a simple 2 or 3 postures is all enough. But then practice pranayama. What I do to practice pranayama is I look upward, I close my eyes, I sit straight with my spinal cord completely straight, and then I start taking slow and deep breaths. Try to take each breath slowly for about 8 to 10 seconds, preferably for 12 and a half seconds. Initially, without practice, you cannot take that long, but try to take as long as possible without hurting yourself and then release. Just see me doing one, then you'll see how we do it. Look up, close your eyes, take a deep breath slowly but powerfully. Now I've taken a breath, now I'm going to release it again slowly but powerfully. Like this, you take 7 breaths, one after the one, trying each time to take in more air but very slowly, and increasing the length of your inspiration and increasing the length of your expiration. And if you practice for a couple of weeks, slowly you will see you can do 5 seconds, 7 seconds, 10 seconds, even 12 and a half seconds of inspiration and the same amount of expiration. You don't have to hold your breath. You can keep both your nose open. You don't have to close any particular nostrils. Then after you practice this at least twice, morning and evening, you can do more. Then sit down and close your eyes and try to concentrate by meditating. And when you meditate, you might have thoughts coming in. That is absolutely fine. You cannot stop thoughts in 1 second. Then you will become Gautama Buddha or Ram Krishna. So it will take ages to stop all your thoughts. But suddenly, when you realize that your thoughts are coming, come back again and try to concentrate again. And again, you may be lost in thoughts. The moment you realize you're in thoughts, come back and concentrate again. One point where you can concentrate is in your breathing. So as you breathe in, concentrate as if you're breathing in. Your the breath that you're taking in is your point of concentration, and breath that you're going out again is your point of concentration. So do this for at least 15 minutes in the morning, 15 minutes in the evening. In between periods, when some news or some information makes you panicky, practice pranayama at least 7 to 10 times. That will help you get over the panic situations immediately. And my email is ibasuray, that is IBASURAY at yahoo.com. Feel free to email me. I'll try to answer as many people as I can. Thank you very much. I really appreciate all of you taking the trouble to come here. Namaskar.